October is Breast Cancer Awareness Month, and in Arkansas, some 2,500 cases are diagnosed each year. Sadly, many women in our state lack access to services or care. Wake Up Central's Journey Taylor shows us how the disparity is worse in more rural areas, including parts of Jefferson County, and how one center is looking to change it.
This building, Carti, means life to me.
A simple health check can be a matter of life and death. It was the case for Alvera Daniel.
It was in the earliest stages, so there was no lump. And if I would have skipped that year, who knows what the next year would have brought.
She says she remembers the call after having her biopsy, which ultimately led her an hour from her home in Fountain Hill to Carti in Pine Bluff. She met with Dr. Yara Robinson, one of South Arkansas's only breast surgical oncologists, expressing her concerns for her health and also her family history, including the death of her sister from breast cancer.
And I remember her clearly telling me, she says, "Your story is not her story."
The pair have truly formed a special relationship, and Daniel is just one of dozens getting this special care from doctors like Robinson.
Well, breast cancer is not just 1 month. It's not just one day, and it's not the color of pink. My breast cancer patients live breast cancer 365 days a year.
Every day, right here in rural Arkansas, doctors are fighting against hard-to-hear statistics.
When we talk about Arkansans being diagnosed with breast cancer, it's about 2,500 women this year. 400 will die of breast cancer. And for Black women, we are actually more likely to die of breast cancer than our white counterparts. The American Cancer Society just came out with new statistics that even though we're less likely to be diagnosed with breast cancer, we're 38% more likely to die of breast cancer than our white counterparts.
Robertson says there are more clinical trials, more research, better treatment plans, and imaging, and also more familiar faces.
I think it's so important for not only for people of color to see a person of color taking care of them, but also a female doctor.
Daniel says for years she made it her duty to make others more aware. Unbeknownst to her, she too will become a patient, but now she's cancer-free.
It feels freeing. That's exactly what it feels, because when you say, I will not forget that the hardest thing that I ever had to say was, "I've got breast cancer."
And with a new outlook on life, Daniels celebrates, but also continues to advocate.
Does not mean stop. It means that you still have to continue to get your mammograms. You still have to do your self-checks.
And of course, she was awesome. And of course, there is more to these disparities with Black women, like comorbidities, from heart disease to even having diabetes.
Right.
She said there's also social constructs in place. So a lot of things to consider when we're talking about Black women and breast cancer, and also in these rural areas. So that's why Carti and Pine Bluff is so significant.
It is significant, and there should be more.
Absolutely.
They shouldn't have to lack access or care.
And of course, they have muffins and mammograms and muffins happening October 21st to the 26th in Pine Bluff. We're going to have more of that online. Anyone is welcome, and you can just make an appointment by visiting carti.com.
Awesome. That could be your mammogram. Our journey may have saved a life. Thank you. Appreciate that.